All right, third recording, please. So we played the film again, the third patient now. Now, these patients are from different parts of the world, yeah? I got loads of them all over the world. So if I start paying people, somebody said I'm paying the actor to jump up and down, I'll be bankrupt, wouldn't I? And I'm teaching you free. I must be mad. No wonder they call me the mad professor. Can we play the film, please? Can we have back the picture, please? Okay, good. Now, so the third patient here, now I use the freeze frame, I can see it, right? He's really jumping up and down like a monkey. So if we're coming back into the internal, the monkey represent, right, the blockages or imbalance of the organ of the spleen, Now, this patient actually, to you, you don't really see it, but to myself or other Taoist, internal Taoist medicine doctors and physicians, actually, this patient the body had expressed 5 animals. Just now, there's small clips already have 5 different animals coming out. So that I'm trying to explain to you a little bit more into it. Obviously, yeah, okay. But I've given a lot of lecture on the 5 animals. So go back to the Facebook video library and check it out yourself, okay? Next picture, please. Now, so after we're talking about a biochemical reaction, okay, now also you can see me using, inserting, or shall we say, pumping energy into the meridians of different patients. So convulsions, okay, happen and spasm happen. Now, this is a very specific ancient study of kinh căn học Jin Jin yeah. On the right-hand side of the picture, these are meridians of the spleen. On the left-hand side, yeah, this is muscular, the blue, thick blue one. These are the ligaments. So in this ancient, shall we say, the Taoist medicine or Chinese medicine, TM, okay, have very, very close relation, because at the end of the day, the meridian actually running along or in between these muscular skeletal, systems. So when you're having a spasm, right, the particular contraction of the muscle, and that's why it creating some kind of motions. Okay, yeah. So when you see the guy jumping up and down like that, so obviously you can see mostly that particular ligaments contractions from the leg. Okay, and the way he's jumping up and down, right, from the ancient records, I can refer it back to the spleen. Obviously, I have to take pulse and other making diagnosis to confirm, is it the spleen? Okay, yeah. So that is why it's very important that I have to link up how we look at through the animals forms or the reactions. Next picture, please. Okay, now, so convulsion on the floor now, so you have convulsion now. And also I want to just to give a bit of credit to these patients, which obviously give me authority to use it. This gentleman is a very respectable solicitor. He's a professional. Okay, yeah. And the first ladies we saw, she's an architect. She's an architect. Okay, yeah. So a lot of the professional people. So maybe those people say that I pay somebody actor to. I got the interview, but obviously I cannot show you the entire interview. Right? They're introducing themselves, what kind of profession they are. So surely, if I pay all different people all over the country, I'll be bankrupt. So please have an open mind. Have an open mind. There's a lot of things that we don't know. The human body is a mind and body is an amazing machine. This is why egg research we want to plug into our mind, right? And our body, not spirit, not soul, and this kind of thing. Okay, yeah. Good. Next picture, please. They can see the convulsion. Just now, you can actually see it. Right now, there's some convulsion, the movement. If I even pay you, you cannot have that kind of spasm happen to the muscles. The way that they twist it around, there's no way, if you're in a conscious state of mind, you can do that. So the only way to think, to look at it is people going into the subconscious state of mind, right? And that's why they do very unusual things. So in the way that Lao Tzu said it in Tao Te Ching, right? Yeah, the name, right? We're talking about a very specific name, are we? So this is the internal Taoist medicine, because name could be any names, but this is a very specific name, Taoist medicine, internal, not external, right? Yeah. The Tao could be many, many, many Tao, but in this particular second, what we are talking about, the Tao, right, is this gentleman's, the convulsion of it. What's he telling me? His body was telling me something happened. And then the way that it twists around and things, okay, it can only achieve that when the mind status or the brain wave is not in a conscious level, because the reaction of it, you can't mimic it. You cannot copy it. So that means it proves that at that particular instant, a lot of time that, if we obviously there and then, if we have the EEG machine, I can put the electro on, we can measure it. You can straight away, we can see the differences from beta to alpha, alpha to theta, theta, even later on, it go into delta. But obviously I don't have the machine there and then. True. Okay, we can do it in a lab. We can do it in a lab. Okay, there's no problem on that. But we have to set up the lab, and a research has no money. Maybe in the future, when we have some money, we have some sponsor, we can do that. Okay. Next picture, please. Okay. Now, these are the bladder channel. Now, you can see that the particular musculoskeletal on the left-hand side, the muscle all the way up from the foot, right, all the way up to the head. Yeah, okay. So that means the entire muscle of this particular strip of ligaments, or ligament and muscles, okay, yeah, is having spasm. So the whole entire body on the floor, right, is having a really strong, powerful spasm. And I'm sure if we can point it back up to the diver's bent just now, the diver's bent. So the convulsion of obviously different muscle strips. Okay, yeah, next picture, please. Okay, yeah, so you watched the film just now. Another picture, please. Okay, now in this particular movement, now you can see his leg is off the floor. If so it's bouncing, it's having a spasm. But when I was working, you can see where I energized. That's the lung meridian there. Okay, the lung meridian. Because at the end of the day, because like I said, we can look back onto the nitrogens, because the air we breathe in actually was only about 20 to 30% oxygen, the nitrogen going into, one breath of air, actually, if I remember, is about 60 to 70% of nitrogens. Okay, so that means that puff of air gone into the nitrogen is very, very important because nitrogen, the amino acid, isn't it? So it's very, very important, in the building block of life. So we have to take, the nitrogen goes in there, but we cannot detain that. That's why the nitrogen has to be passed out. So if the nitrogen hasn't been passed out, that's why the imbalances affecting different joints and different organs, right? You can see that when I energize through his lung, and the reaction is, yes, I was right, because by looking at that kind of, convulsion, and now put in this theory of the Taoist, internal Taoist medicine, I energized that, he got really powerful reaction. Okay, next picture, please. Okay, so now this is from the musculoskeletal system again. This is the lung, right? The lung channels, which you saw the second patient when the thumb and everything like curled up like that, Okay, yeah. Next picture, please. Okay, and also it is the liver, because when the stackling, like running like a deer. So in the 5 animal is like running a deer. That's why the ancient Chinese talking about the animal like a deer, because you can see that the spasm of the particular meridian. Okay, this is a very, very specific study of meridian and, the ligaments strips, and that's creating the running deer, the deer's very, very fast running motions. Okay, yeah. Next one, please. Okay, that's it. Can we play back? We got a bit of time. Can we play back the third one so we can just you can see the third one again?
Yes, we can.
Oh, thank you. Let's see. Thank you. Yeah. Okay, so now you can see actually the 5 animal actually came out, and obviously okay, thank you. Now, so the conclusion of this conclusion is, you can see how I'm relating, right? Because the arthritis and rheumatism, these are only 3. I got loads of, capture on camera of patients. Like I said, again, I did not use any medication outside the body. So that means it's a self-healing phenomenon. Okay, yeah, I'm just only using the energy, right, to trigger the body to heal itself. So it's a self-healing therapy. Okay, yeah. But also there are 2 types of therapy from the internal Taoist medicine. One is the subconsciousness, spontaneous reaction. So subconsciousness, right? And these case studies are subconsciousness. Now, previously, I have conscious methodology, which people don't go into subconscious, but they're using exercises. And the best one is another patient's having the problem really severe eczema. I haven't zapped him. I haven't treated him with the subconscious level. I'm just teaching him, the methodology. So it's been filmed. It's been, make it into a lecture. So if you go back to Facebook Video Library, you can check it out. So there are 2 types of therapy, shall we say, 2 types of therapies. Yeah, right. We use consciousness and subconsciousness of the mind. So that's why we call it mind and body. because this is the boss. You deal with the boss first, right? Then you deal with the body, because the boss would release all the, obviously all the hormones or biochemical reactions, different type of, hormones or night down or natural body medicine, body medicine, if you want to call it. Okay. Yeah. And then balance itself. So this is how we're relating it. So from the blockages, why you can see the biochemical reaction, the biochemical blockages, which is from myself point of view, is the nitrogens bubbles inside, right? Yeah, it's excessive. So I've also used the diver's bend, right, to relating into it. Okay, yeah. And then the musculoskeletal, and you can see that because of the contraction, the convulsions of different particular ligaments, which run along with the meridians. Okay, yeah. So we can also, that's how I testified it. It is also the muscular skeletal blockages. And then finally, because the musculoskeletal blockages will actually crammed up and will probably press upon some nerve fibers, because we have so, all the very minute nerve fibers, and it be or squeezing in blockages, squeezing it, of course it's painful. So all the joints and things. So that's how I testified it as neurological blockages. So these are the 3 blockages we look at, okay, through the internal Taoist medicines, and we make assessment, diagnosis on it, and we try to find out the pathological factors as well. So this is how I teach in Beijing University, Shandong University, Sichuan University, so many different, even outside China. Okay, yeah. So good. Time's really up there, and I'll take some questions. Then any question coming in, please?